Good evening and welcome everyone. Today is our 1976th day of continuous webinar. Today's our guest is Dr. Beatrix from Germany. Dr. Manoj, Dr. Beatrix has joined.
Yes, now joined.
Okay.
Yes.
Okay, welcome. Welcome all the participants for today's session. Today's our guest is Dr. Beatrix. She is from Germany and she's working as a medical doctor for 36 years and working as a homeopath for 34 years and running her own clinic for 31 years. And she specialized in dermatology, pediatrics, and general medicine. And more than that, she is our IFPH coordinator of Germany, and she has united many homeopaths from Germany and actively taken part in many initiatives. Thank you so much, Beatrix, Dr. Beatrix, for being with us, and we are warmly welcome you for today's session. You're welcome, please. Sorry.
Okay. So thank you very, very much for your very nice words, dear Dr. Imali. Always a pleasure to be with you. And today we will have a very special subject. It is a book review about the very, very famous book of Professor Vithoulkas called The Levels of Health. And I'm talking about the last edition, which was presented in 2022, some short time ago. So I feel that this concept of levels of health is very, very helpful and valuable in our practical work. I personally know Dr. Vithoulkas about more than 40 years because of his teachings in Germany and in Greece. He convinced me in that time to become a homeopath in spite of already working as an allopathic doctor. So he inspired a lot of colleagues in Western Europe, in Germany, and that means that I'm very, very grateful to him. And I really admire his way of teaching, always on the clear basis of classical homeopathy. And I was impressed by his profound knowledge, his amazing results, and his very, very particular and special personality. And last December 25, I was participating at an online webinar with him and his group, and more than 900 colleagues were participating from all the world, more than 60 countries. And the topic was treatment of acute conditions during chronic disease. Acute conditions during chronic disease. Shall we wait? Shall we give a remedy? Shall we change the remedy? So I also will include that information at the end of this presentation. So to start with some biographical information about Professor Vithoulkas, I would like to share now my screen. You can see the slides?
Yes.
Yes? Okay. Hello, Dr. Manoj. Greetings.
Thank you.
Okay, levels of health. Let's have it in a big way. Okay, about the author. He was born in Greece in 32, and he was grown up during the Second World War. And he always was talking, when he was talking about his childhood, he said to us, I received the greatest suffering from German people because My father and my mother died. But I also received the greatest joy from German people because of homeopathy. So his story is a bit like this. He was growing up, and because of lack of food and vitamins, he had problems with his spine, columnar spine in the back, and he had a lot of pains. He studied to become an engineer, and he went to South Africa to work there. And because of his pains, he tried to find some therapy to help him. And in South Africa have been doctors from India. So he he went to a library. He found a book. He found the Bödeke, and he told me that story. He was opening the book, was starting to read, and never stopped again. It was something so special for him, and he had the impression that he would understand everything. So he was so much inspired by homeopathy. He started to treat people, and he also studied in South Africa for 2 years. And then he went to, in 62, he went to India to study correctly homeopathy. It was the only place where he could, in the world, where he could study homeopathy. He did so for some years and got his approbation in 66. And 1 year later, he went with Krishnamurti. I think he was a famous guru in India at that time, Krishnamurti. He went to Switzerland. And from Switzerland, he went to Greece, to Athens, and opened a clinic with medical doctors. He always liked to work together with medical doctors because he himself, in Europe, he was an engineer and studied homeopath, but not a medical doctor. So he combined with the doctors in Greece, and after a short time, there was a very good development. People were very impressed by the results of homeopathy, and we can say he was one of the first who entered into Europe with a great charisma and starting a big wave of teaching modern homeopathy, which in a classical way in our countries. So in 97, he organized the Liga Congress. You know, that's the worldwide Congress. It's once a year. And he organized this Congress in Athens, in Greece. So there also something very interesting happened. A big group from France were participating, and they were in favor of complex homeopathy, low potency, complex in one dose. And there was another group from Argentina, very classical homeopaths, like nowadays also. And there was a kind of big discussion, kind of fight. And at the end, the Argentinian people said, we want classical homeopathy, only one remedy at one time. If you want to change here, we will leave. So at the end, the French group left and the Argentinian people stayed with Professor Vithoulkas. And from this on, in Western Germany, we got the teaching of classical homeopathy. Due to Professor Vithoulkas and due to the Argentinian colleagues. So Professor Vithoulkas has many, how you say, is a professor and honored professor of many universities in the world, like in Greece, of course, also in Colombia, in Russia, Ukraine, Romania. And in 1980, he was invited by the World Health Organization to write the first article on homeopathy for the book Traditional Medicine. And in 96, very special, he was honored in Sweden with the Right Livelihood Award, also known as the Alternative Nobel Prize for Medicine, for his great work and success. In 96, he also was invited by the European Parliament to explain the position of homeopathy, and after his presentation, the European Parliament voted in favor of homeopathy. So, if we want to start with the levels of health, first, easy picture, he is defining 12 levels of health in 4 groups. Every group has 3 levels. 1 to 3 is group A. 4 to 6 is group B. 7 to 9, group C. And 10 to 12, group D. This one I have to make a bit more clear for you. Just a second. That you can read. So the main differentiation is group A are the more healthy people. Level A are the very healthy people, and he is defining these groups by the possibility of the organism to develop acute diseases with fever. As long as the body is able to develop fever, it is a good sign. Of course, the best sign is not to have a lot of infections and not to have a lot of fever. So group A, they have, it's on the right side, I hope you can read it. Group A, they don't have many acutes, or rarely, they are healthy people. Level 1, normally they don't, never get a common cold with a great fever. Level 2 and 3, yes. The next group, B, these people are not so bad, but they have a tendency to have colds, common colds, fevers, infections. In the level 4, more easy. In the level 6, more difficult. I will explain this more in detail afterwards. Now, group C, they have mild acutes or no acutes. That means if the body is not able to produce acutes, the vital force is quite compromised. And level D, unfortunately, are the people which are incurable, and they will never have acute fevers. So, if we go on, if we explain the different groups step by step, group 1, level 1 to 3. In this group, diseases are mostly characterized by functional, uncomplicated disturbances, such as mild, infrequent headaches, skin eruptions, eczema, premenstrual syndrome without endometriosis, sciatica, and minor form of articular and muscular pains. So more the functional forms, the easy forms, but still suffering. So these people come to our clinics. Acute diseases do not affect the people in level 1. That's the highest level of health. And in the other levels, 2 and 3, there are infrequent, superficially infections with high fever occur on level 2. In general, these diseases do not affect the patient's general states. So he gets the cold, he gets the fever, and afterwards he's completely normal again. Restitutio ad integrum. Everything is fine. On the microbial level, they have microbial infections that are not very resistant to antibiotics, easy germs like Staphylococcus, Streptococcus, easy to treat. Another very important point is these healthy people, they have clear symptoms because the life force is very good, it's presenting the symptoms, and for us, these people are easy to treat. And the prescribed remedy, if we use high potencies, will work for many months or even years. They react very well on the potencies. And initial aggravation does not necessarily occur in this group A. So group B is with less vital activity. Here, the immune system is already a bit weakened. These people present with more acute and frequent infections. We have lot of these patients in our clinics, also in Germany. Again, another infection, throat pain with fever, again after 6 weeks. And so this is group B, and the level of health declines. The infection appear more regularly and more serious. These people also can have the tendency to develop a pneumonia, a pyelonephritis from time to time. And the microbes are more violent and more antibiotic resistant, like proteus, pseudomonas, the more difficult. During treatment, the patient's acute diseases become less severe and less frequent if we treat well with homeopathy. Here, the symptoms can still point to a remedy, but often it's not like this, that one remedy will be enough or two. Often in these levels, we need a series of 2 until 5 remedies that will be necessary because the condition is more difficult to treat. And initial aggravation can be quite strong. Group C, in this group, the diseases are even more serious. They include organic disorder, such as morbus Crohn disease, colitis, bronchial asthma, collagen diseases, epilepsy, autoimmune diseases, Parkinson, anxiety disorders, phobias and depression, and much more. If we approach level 7, there may still be a few acute diseases, but these are mild and not accompanied by high fever. In level 8 to 9, susceptibility to acute infection is no longer observed. Okay. Here, the remedies necessary to treat the chronic condition will not be so clear. That makes it more difficult for us. This organism has several layers requiring treatment. As Professor Vithoulkas often was explaining, we have layers in our health. So first we treat the first layer, and then we see different in chronic diseases, and later we see a different condition. There can be another remedy and also another layer. And he's explaining like an onion, one layer, one layer, one layer. We also could explain with the concept of the miasms. Here, the initial aggravation after the correct remedies or treatment are common and are more strong. So here we have to be careful. What we know, if the life force is less strong, we should not give such high potencies because they can provoke long-lasting and severe aggravations. During treatment for chronic conditions, if acute diseases reappear and often need to be treated with one or more remedies. But if in the chronic condition, acute again reappears, that is a very, very good sign, and we don't have to touch here. We have to wait if it's possible. And now to group D. Here we have more serious diseases with organ changes like cancer, with metastasis, cirrhosis, serious heart diseases, juvenile diabetes, neuromuscular diseases, schizophrenia, Alzheimer, the difficult ones. If acute diseases appear, they can be fatal in this group. So symptoms will not be clear and the picture can change rapidly from one remedy to another. So that's why always our colleagues from India, the Parekhs from the family Parekhs from Accra is explaining and teaching that if we have really severe diseases like cancer, we have to start with the little remedies step by step, and later it will be possible to give a constitutional remedy. So in this lowest levels of health, homeopathy can only palliate. Okay. I don't know whether you are able to hear. Can you listen?
No, not audible, madam.
Okay, but you can see Professor Vithoulkas for a moment. 30 years ago, he was more young. Okay. So why are we talking about this topic? Now we already have done all the different categories. And so only one remedy. There are homeopaths worldwide who are saying, oh, I cured my patient with only one remedy. This is possible. But this will be the highest level of health, group A, level 1. Here we can have these results. So literature in case presentation in homeopathy sometimes gives the impression of marvelous cures with one or two remedies. This only happens to the fortunate people with a very strong condition on level 1. Here's a book. Today, in most cases, the practitioner encounter are multifaceted and complicated by previously prescribed allopathic medications, as well as layered pathology. They require sequential remedies. That means the patients we have in our clinics, very often, they come with chronic diseases, which are multi-layered. So we cannot expect to cure that patient with a chronic rheumatism and also kidney problems and this problem. We cannot expect to cure these people with one remedy. I think we all would agree about this. So, and that means it's a way to treat. On the road towards health, we will have to be very careful to look about the different remedies. It will be a series of remedies and certainly miasmatic remedies in between. And now that's the main point, perhaps, about why he did write this book. So, insight into the levels of health should help the practitioner to clarify the reason for successful treatment in accomplishing a cure in some cases, while failing in other cases with the same pathology. And sometimes we are meeting these patients. We have one patient like with chronic asthmatic conditions, worse in wet weather, having also headaches. A case of natrium sulfuricum, for example. Oh, and we are very happy. Developing easily, less headaches, the asthma is going away, it does not need any allopathic medication anymore. And some months later, another patient comes, more or less with the same pathology. Oh, I had a good case of natrium sulfuricum. Now I give it again to this person, same symptomatology, and it doesn't work. So that means they can have the same pathology, but if the level of health is different, they will not have the same line of cure, these two examples of patients. So for us, it can be very interesting to understand what is the vital force of the patient in front of me. Also, what is the miasmatic load of this patient? And to understand like this, the prognosis of possibility of cure and prognosis of how quickly and how easily that person can be cured. So I also like this word for the vital force. He's saying it is the energy complex of the body. And disease is not a fixed, static condition of the organism. It's also dynamic. Very important to understand this. So the successful treatment, whether the treatment will be successful, depends mostly on the condition of the patient's vital force. I think we all will agree about this. And the defense mechanism, every symptom or syndrome, acute or chronic, appears because it is the best possibility of counteracting the disease that the organism has chosen. So the organism, in his wisdom, always is trying to choose the less harmful condition to show that he is imbalanced, that the vital force is not in balance anymore. But at the same time, the patient has these symptoms. He's showing my vital force is not in balance, and the organism is not able to cure himself by normal ways of more sleeping, more drinking, having good food, having fresh air. So in that case, these people need treatment and need homeopathic treatment, dynamic treatment. So let's also talk about the initial aggravation. If a similar remedy is administered to the patient, it will stimulate the defense mechanism in a positive manner. After a possible initial aggravation, it will restore the organism's homeostasis. So the initial aggravation can be also a good sign, but should not exceed more than some hours or 1 or 2 days, depends on the condition. But generally, Professor Vithoulkas is explaining that it is, in his work with high potencies, that this can be a very good and very clear sign. I know that my colleagues in Argentina and South America, they prefer to work with LM potencies, not to have aggravations. Complexity of the system. The actual defense mechanism is built in such a complex fashion that our understanding of its total functioning has neither been completely investigated or totally comprehended, and that is true. Let's also talk about the suppression of symptoms. Professor Vithoulkas is talking a lot about suppression made by allopathic drugs, made by vaccinations. And he's very stressing that symptoms are beneficial because they are generated to counteract disease and to show, as Dr. Hahnemann clearly said in his first paragraphs, to bring to the eyes of the homeopathic practitioner what he needs to know and what is to be cured. If these conditions are not treated appropriately and the symptoms are suppressed by strong chemical drugs, the defense mechanism will be forced to shift it and respond and reduce symptoms on a deeper level. Like if we have an eczema, which is very active and long lasting, and we start to put cortisone on it, it can be much better on the skin, the situation, but the whole disturbance of the vital force can go more inside, producing asthmatic condition, producing intestinal conditions, as we all know. So very important not to suppress. And what I feel, I started to read the organon again, also being meeting my colleagues in South America, in Argentina, and they're working on the organon. And I was inspired again. And I feel that we are the only medicine, the homeopathic medicine is the only medicine who is talking and understanding the bad effects of suppression. And Dr. Hahnemann himself, in his time, saw the treatment of syphilis in his time with so much mercury and very intoxicating doses. He was very, very against that form. And we have it's very clear in our conception of health and disease and seeing our patients that suppression of symptoms is something very harmful. So the symptom complexes that simulate disease, also very nicely expressed. The patient's symptoms are the compass for a homeopath to find the correct remedy. In homeopathy, various simple substances have been tested on healthy humans and were found to produce symptom complexes that simulate disease response. So what is happening? He's explaining what is happening if we are proving a remedy in a healthy person. It can produce pathologies, the beginning of pathologies, that means symptom complexes, which are seen in diseases we have with our patients. So also very important, the direction of cure. We know this by the laws of Hering. When the direction is positive, the symptoms will move from vital organs towards the superficial and likewise from the mental, emotional plane to the physical plane. Professor Vithoulkas was explaining very well how important it is to have the disturbance being, how we say, being in the physical body to be expelled. And he was talking a lot about his experience in India. And he was with that guru, Krishnamurti, and so many people from Europe in that time over there to be with the guru, and nice people, intellectual people. But he said they were intellectualizing so much. And if they had with them, often the disturbance was on the mental or emotional plane. So if you give a good remedy, normally, and the disturbance is more on the mental plane, normally the disturbance has to leave, go through the body, producing acute infection or producing a physical complaint for some time to leave the body. So now we come to the topic of miasm, which I know are very present in India, and I'm very grateful. I have learned again from you how important we have to see the miasms, and you have a very, very good system, I feel, to integrate them in the chronic treatment. So when sequential acute conditions are repeatedly suppressed, such as with chemical medication, the underlying predisposition can be activated. So he's very often was explaining like this. You know, I have been with Professor Vithoulkas many, many, many weeks. There were always seminars in Greece on the island of Alonisos. He has a very, very nice building there for more than 100 students. Very nicely built with natural stones. And he was teaching us a lot. So I have been there 4 or 5 times, more or less 10 weeks, staying there in Greece, always getting the teaching. And he always said in that time already, you know, we all of us, we have genetic predispositions. If we are young, normally that does not matter so much. If we are getting older, and the life is getting more difficult, and we are taking suppressive drugs. Here is a point that the genetic predisposition can appear from sleeping to appearing. So, and he also explained the practitioner must realize that an individual can be born into any level of health, depending on their genetic predisposition. So we can have a little child, which unfortunately is level 8 or 9. And we can have an old person of 19 years with level 2 and having a good and healthy life. So the genetic predisposition, also the miasma, is quasi the most important background of disease. Everyone is born with a genetic predisposition to live a certain length of time. The better the level, the longer we can live without any physical problems. Through correct prescribing, it is easier to raise, that's also important. Through correct prescribing, it is easier to raise the level of health in a person who has moved downwards because of abuse of the organism, lot of chemical drugs, vaccinations. We can rise again this level of health. But the genetic predisposition is it's very difficult to raise. We can perhaps raise it a bit, but not with a real jump. Between level 1 and 5, the immune system responds with an inflammatory reaction and high fever. A different range of bacteria, viruses, and fungi affects people in each level of health. The more easy in the beginning of the higher levels, the more difficult in the lower levels. And in the higher levels of health, the miasmatic influence is minimal. Sometimes here we see that the same remedy fits for the acute and the chronic condition. So that's why some colleagues are telling, oh, you only have to give the constitutional remedy. It will help with the chronic situation and also with the acute situation. And they are right. But that means that this person is level A, group A, level 1 or 2 or 3. This phenomena only occurs in those fortunate people who are on the uppermost levels of health, and that one remedy is a patient constitutional remedy. And now he was very strong, saying a constitutional remedy does not exist in any other level of health, only in the group A. People in lower levels of health have a severely compromised defense mechanism. These require a sequence of remedies. We already said this. And the greater the weakness of the defense mechanism, the greater the possibility that the remedy will not easily be found. That's also a very important point. As we are going down the levels, it's more difficult to see a clear picture. We see a lot of symptoms combined, and we as homeopathic therapists, we are asking ourselves, what's happening here? Why I don't understand this case? What I am doing wrong? But if we understand that it's depending on the level of health, it can be more easy for us to be more neutral, more objective. Okay, this seems a patient with a lower level of health, so the infection will be more severe. The remedies may be more difficult to find. The potency should not be so high. The aggravation could be more strong. Tuck, tuck, tuck. So to reiterate the idea that all patients have one constitutional or core remedy is essentially a myth. Also very strong by Professor Vithoulkas. This does not apply to everybody. The only exception to this would be those patients who are at the highest levels of health who require just 1 or 2 remedies. These patients constitute only 3 to 5% of all homeopathic cases. That means we don't have to expect to cure a chronic disease in very short time with just 1 or 2 remedies. Only if we have a very healthy person in front of us. And I don't know whether you know this rule. When I was studying homeopathy, they told us, and I find it very helpful also, the time we need to cure a case. So if the patient has a disease, a chronic disease, like chronic asthma, rheumatism, since 10 years, it will be at least 1 year to cure this, or ameliorate a lot this person. So that rule of 1 to 10 is also very important. If the disease is since 20 years, we will not accomplish in 2 months. No, we have to tell the patient we will need more or less 2 years to be able in a series of remedies to help you. The repetition of doses. As a general rule, one must stop repeating the remedy once there is an aggravation. That is very important. Not going on having the aggravation and giving more and more. After this aggravation, amelioration must and will follow with a correct remedy, unless the aggravation is due to other reasons. For a practitioner to guide a case successfully through chronic diseases into acute and back to health, one must be thoroughly educated in this science. Human organisms and the energy animating them are so subtle, complex, and unpredictable that we cannot easily affix rules without exception. So he says, okay, I'm explaining everything. I have my concept. It's very clear. And you also feel this Professor Vithoulkas, that he's an engineer, because he really is very clear and very logic. But he says, of course, always there can be an exception. Life is life. The optimal response to homeopathic treatment is a huge jump in the level of health that not only reduces symptoms, but also leaves the patient being regenerated, feeling better, having more energy. This is what we also experience in our daily work. So nearly coming to the end now, observations. After an initial aggravation, the patient feels much better in every aspect, but some symptoms remain. Okay, we have an aggravation. The patient is saying he feels better in this and this and this aspect, but still have some symptoms. What are we going to do? Here, no remedy should be prescribed for minor symptoms if the general state is much improved. The best solution here is to wait. Subsequently, minor symptoms will either abate soon by themselves or form the basis of an underlying remedy to lead us to the next prescription. Observation 4. After an initial aggravation, there is local and general amelioration, but new symptoms appear belonging to the remedy given. Sometimes this is happening. What we have to do now? He's saying, if this is occurring, it is an excellent reaction belonging to the uppermost levels, reaction, initial aggravation, and also producing a few symptoms of the remedy, which we have not been present before. That also means it was strong enough, the potency. This reaction confirms that the remedy is correct. Wait and see. It is simply a matter of time before the symptoms will disappear again. Observation 4. Note that it is a very good sign when a patient whose condition has generally improved shows new symptoms not related to the remedy, but to old, now recurring symptoms. So situations from the past are coming up. This suggests that the remedy was correct, provided that there was an initial aggravation followed by an amelioration that leads to a reappearance of symptoms. It's also a good sign. We have time to discuss about this later. Just to finish now, 1 month. Okay, so this is from that webinar. I have to tell clearly they made a summary, because it's a big chapter also in this book, what is happening after giving the remedy. He's explaining after 3 days, 4 weeks, 6 months, but let's just have a look at the appearance of an acute disease 1 month after taking a remedy for the chronic condition. So, group A, the patient should already be better chronically and should not develop an acute so quickly within 1 month. Any antidotal interference must be investigated, something which was disturbing the remedy. If this acute is mild, wait. If this acute is severe, treat. After the acute, after the acute is a relapse, asked, is it a strong relapse, a full relapse, or only a part relapsing? And try to wait. If it's a strong relapse, here you might need a repetition of the same remedy for the chronic situation. This is with the healthy people, group A. So if you look at group B, if same intensity of the colds and infections are there, the remedy probably did not act. Group B are the patients which come with more frequent infections, fevers, disturbances. You give the remedy as a chronic remedy. And if the infections are continuing the same way, okay, after 1 month, you can say the remedy did not act. If there was an initial aggravation followed by an amelioration, and then the acute antidotal influences must be investigated. But he's saying after 1 month, if there was an aggravation in the beginning, followed by an amelioration, but again, some infections, he says very strongly we have to look whether something was disturbing the remedy. And he was very, very furious about drinking coffee. But the funny story was he himself, Dr. Vithoulkas, was drinking a lot of coffee during the seminars because he had so much work. He was drinking his coffee, and the patient, yes, I was fine, and everything was better. And then there was something, and no, I'm not good anymore. And he, did you drink some coffee? Perhaps after some weeks, I did drink a cup of coffee. I did think it was not so bad. No, you should not have done this. It was a disturbance of the remedy. So could be coffee, could be also 20, 30 years ago, when also here in Germany, when we have been painting in our houses, the paint himself had etheric substances. And this also could, for instance, disturb the remedy. Nowadays, it's not so much like this. So to say the group B also, we have a lot of people in our practice in group B. If there was a reaction, aggravation followed by an amelioration, but not a long-lasting cure, something could have been disturbing. If there was no real initial reaction, but the patient only thought he was doing better, perhaps the remedy is not correct. Okay, now just to come to that, group C. Here, usually, there are no acutes for several years. Chronic conditions, but no acutes. So if an acute develops in a month after taking the remedy, this is an excellent indication, a very good sign. Group 7 is the first level, not group 7, level 7 in group C. Usually the fevers are more or less 38.5. The other levels are more slow, more low. So the other levels never enter in a febrile state within only 1 month or even a year. When febrile conditions occur in this level, the acute will be quite serious, but manageable with the correct remedies. So he's saying like this, and was giving a lot of examples and cases, treating with severe conditions. They 10, 15 years never had an acute fever. The acute fever is occurring, but it can be a difficult fever, like a pneumonia, pyelonephritis, something difficult. And he said, we have to try to treat this homeopathic remedy. But if it's not possible, you have also patient first. You have perhaps also to give allopathic drugs to not to harm the patient. So, and he also say often require more than one remedy to treat these acute conditions. So, to say, have a summary, if we have an acute condition with fever, in the first month after giving the constitutional remedy, it's not such a good sign in the healthy groups, but in group C, it's a very good sign, and we really have to wait and not to touch if possible, because the organism is getting in a better state. So I just want to say, dear Dr. Professor Vithoulkas, was a great pleasure to meet you in my life and to be when it was possible to learn. And for us here in Germany, mostly all of us have been students of Dr. Vithoulkas, and we still are working with a group of allopathic doctors who have been trained in these times, and we're still in contact. And it was a pleasure for me also, and very important for me also, to share that knowledge to you.
Thank
So
you. Have you finished? Thank you
yes,
so
I
much.
just wanted to open for the discussion, Dr. Ainali, but that is your part.
Thank you so much. You have shared very valuable and insightful points here. Thank you very much. And the participants, if you have any questions, you can ask to Dr. Beatrix. Dr. Manoj, you can, please.
Yes, it's not questions, but adding something. I think this was initiated by Dr. Samuel Hahnemann himself. You can see among the mishaps that happening during the treatment of chronic disease. In this way, he described a lot of medicines. So it was there. Then these persons really beautifully developed that idea. Then again, you mentioned about the strong orders, the paint, similar the scents that used in snuffs, that should be interdicted as advised by Dr. Hahnemann. Then again, the aggravation of conditions. It is not only from the diseases, but also from some causes, some conditions, or some situations, or accidents, as you mentioned, accidents that will aggravate. For example, if you expose to the heat of sun after taking this epismel or glonine, definitely that condition will aggravate the symptoms of patient. So there, the remedy is not aggravating the disease, but the circumstances. So we must discriminate between these things before judging whether it's a medicinal aggravation or something more than that. Then again, another interesting term mentioned by our master is that aggravation of his own disease. That means the individual symptoms. Okay, very nice presentation. Congratulations for your endeavors. Thank you.
Thank you so much, Dr. Manoj. And now I am inviting Dr. Gustavo Pirra.
Okay, thank you. Okay. Well, thank you very much, Beatriz, about your work, because put us in the thinking new things. There is a difference between the 5th edition that usually use Vithoulkas about talking about vital force. In the 6th edition, Hahnemann used principle vital, because in the principle vitals is he make a difference between dynamics of the dynamics of the patient and the constitution, corporal constitution of the patient. All these levels are very well for the student, because they could know that the kind of patient is in front of them. In the first levels, the healing crisis is very good for the patient, because make the solution. Hahnemann talks about this in chronic disease, second edition. He talked a lot about the importance of the main of the crisis, but the healing crisis. And in the level of the group C and D, it's very important to be careful about the appearing the crisis, the healing crisis. You must be trying to arrive to the crisis, because the problem is that the organism is so damaged that could not make this crisis healing. So the doctor with the remedies will try to arrive to produce this That is very different from the usual healing. You talk about also about the LM of the sex, the Q potencies of the sixth edition. And Kahneman tried to solution all these problems with the Q potencies. Because the Q potencies, you need to succussion the dose before giving to the patient each time. That makes a big difference from giving the only one remedy in the same way. These changes modify the degrees of the potency. It's more friendly for the principal vital. So this friendly makes to arrive to the healing faster. But there is a problem because in those years using the two potency, I try to notice what is the disadvantage to use them. What are the disadvantages of the two potency? Is the adherence of the doctors in the beginning to this method and the adherence of the patient, because you probably repeat incorrectly the remedy, and this give too much doses, and the aggravation could appear. That is the main thing, because all the other things of the Q potencies is so benefit for increase the arriving to the healing of the patient when he's in a situation of the healing groups C or D. I prefer to use Q potencies in those groups because it's more easily to arrive to the cure of the patient. But you must be relation with the method of the Q potency, because so we have to make a standardization for that. And for the end, we must make a difference, because a chronic disease is for natural and a chronic disease that is for a chronic intoxication of the patient. That is very important in our countries. So don't confuse that, because they need different treatment. So that's the idea. Well, thank you very much, Beatriz, for your explanation. It produced new concepts.
Thank you. Thank you, Dr. Gustavo. And Dr. Shaji Kudiat?
Thank you very much, Dr. Beatriz, Dr. Gustavo, and so many others from different parts of the world. Today there was a nice presentation. Of course, Dr. George Vithoulkas is one of the most prominent homeopathy doctors of our times. He done a lot of things to promote homeopathy internationally, and he succeeded in that. I also visited him in 2002 and stayed alone in Alonisos for 2 weeks of time. So we have a good time with him. And he's still alive with the same appearance and activity as I see him in 2002. It is nice to see that. He presented his ideas in a nice manner, his perspective, and it is good and that you explained and reminded us the same at this time too. So, and thank you, Dr. Gustavo, for commenting on this and all others who attended this session. I have nothing more to add, because that is one important person's narrative and opinion. So thank you for reproducing it, and it is nice to listen. Thank you, Dr. Beatrice, for this. Thank you.
Thank you, Dr. Shaji Kudiat. Now I'm inviting Dr. Mariam Salcedo for giving out of thanks to Dr. Beatrix.
Hi, Mariam.
Thanks, Dr. Regina. Nice to see you. Good evening there. Good morning in South America. Was an excellent presentation, seeing not only the disease, but the whole, the constitution, modalities, and the most subtle aspects, such as the response of vital energy, is a gift taught by Dr. Samuel Hahnemann, and perfected or rather facilitated in understanding these subtleties as Dr. Vithoulkas. This allows us to sharpen our homeopathic vision when deciding on potency and dosage at the time of prescription. So thanks so much, Dr. Beatrix, for your nice work. Thanks so much to all Ifph team for the opportunity to meet daily and grow as a community. So visit us in all the social medias, and always is an honor to be and share with you all. Thanks so much.
Thank you, Dr. Mariam Salcedo, and thank you, Dr. Beatrix, once again. And now it is the time to hand over our session to Malayalam. Dr. Boblim, have you, if you want to talk something?
Yeah, I would like to say congratulations, Guten Tag to Fräulein Dr. Beatrix Gessner for a very, very good presentation. Excellent. The levels of health in the autobiography of Professor Georgos Vithoulkas, and she is a very keen student of Dr. Georgos Vithoulkas. And I'd like to add something that in the final level of health, that is the lowest level of health, the fever should not occur, right, Dr. Beatrix?
That's right. That's correct. Yes. And I also was so happy to present because Dr. Vithoulkas is so clear and so classical and has so much experience and has a very good heart. So that energy I hope you did feel now. And I will be also happy to meet Dr. Gustavo soon, and we will go on the discussion, huh, Gustavo? Very nice.
Yeah, thank you very much.
Mariam. It was also nice to see you, and Bob Lim, all of us, and Dr. Shaji, Dr. Manoj. Many greetings from Germany.
Thank you so much. So we are moving
Dr.
to the
Sandra. Dr. Sandra wish to say something.
If you want to talk,
Dr. Rui Pinto from Portugal is also there. He wished to say something. Dr. Rui.
Yes, please. Rui Pinto,
Dr. Rui, you can open your video and say something. He is there.
Dr. Roy, right?
Rui, R-U-I.
Rui Pinto from Portugal.
Yeah.
Rui Pinto, ¿dónde estás?
Yeah. He's there. Yeah.
Okay. So we say greetings.
Okay. He is not responding.
Okay, then today I'm very happy to see many faces here. All videos are open, and many now it looked like an international team. So Dr. Beatrix, you have to come again and again, take classes. If we can see many faces here. Happy. Anyway, good night, and thank you everyone for joining with us. And I'm handing over the session to Dr. P. Shaila. Dr. Shaila, you are welcome, please. Thank you. Good night. Love
Dr. Pinto is there already.
Hello, hi, Beatrix.
Pinto, ¿cómo estás?
Yeah, Dr. Rui.
Greetings from Portugal. Thank you for your presentation, Beatrix. It's very good. Thank you.
Yes, Dr. Vithoulkas is very good. Yes.
Thank you.
Okay, thank you, Dr. Ajini.